Welcome back to Spend Less, Live Well. I'm Dr. Josh Luke. Today, I have a special guest, somebody I got to know last year, and really not only got to know her and what a great person she is, but learned about her company, which is another great example of how you as an individual can become an EHC, an engaged healthcare consumer. In my Health Wealth book series, you hear a lot about becoming an EHC, an engaged healthcare consumer, and almost everybody can engage on the pharmaceutical side. It's probably the easiest way to engage without having to learn a lot by just looking at the medications you and your family are ordering and finding out a better, more efficient way to take drugs at a more cost-efficient rate. And Corey's an expert in that area. So Corey Biscoglia with a Benecard PBF. Welcome to the show.
Thanks, Josh. Yeah, this is great. I'm so glad to be here. I appreciate your time.
Yeah, I'm excited too. I've been seeing you blow up on social media and your company and all the great things you're doing. So first of all, Corey, tell us what Benecard PBF does. And then I'd really love to know kind of what led you there, because I know you're passionate about this topic.
Absolutely. So we are a pharmaceutical benefit manager. What that means is you have access to your pharmacy. When you need a medication, you go, you get that medication, and we behind the scenes are filling that for you. And we'll talk a little bit about later, but making sure it's appropriate for you. And some companies will carve out their pharmacy from their medical, and in the self-insured space, especially, employers will look to identify the best partner to manage the cost and achieve improved health outcomes. So that's what we do in a nutshell.
Yeah, and now a lot of our listeners are just moms, dads, working professionals looking to save money. And Benecard PBF, if your organization works with them or somebody similar, you already have a head start. And if you're unfamiliar with whether or not your employer has access to a benefit like Benecard, you can go ahead and reach out to Corey. Corey is on LinkedIn. That's how her and I actually communicate more often than not since we met. But Benecard PBF is contracts with your employer. They're very heavy in the self-funded 100 employer or larger, but are willing to talk to anybody and listen to anybody who's interested in acquiring their services. So Corey, your story about how you what were you doing before you got to Benecard PBF, and what really led you there?
It's a dynamic story, so I'll try to keep it short and sweet. My background's actually in education. And so I have my master's in ed leadership. I was on track. I wanted to be a principal. And then I became a mom. I had 2 children. I stayed home with them for a little bit. And I thought, I'm going to dabble into the business world and build some business acumen and see what makes sense for me. So I entered a sales role in the fire industry, believe it or not. And my father was an actuary. So this health insurance space for me was very, very, very well known.
Yeah.
And this opportunity came up, and I spoke with a recruiter, and I thought, what's most important to me? And those 2 things are fitting in with the culture and believing in the business philosophy. And so as we went through the process to see if it was a good fit for both of us, I was really honing in on those 2 things specifically. And I very naturally felt comfortable from a cultural perspective with this company. And then in terms of the philosophy, it was very clear to me that everybody in the company knew it, everybody believed it, and that all decisions really come from that core philosophy. So I joined the team. PBM is a very dynamic space. There is a lot to learn, and I'll never call myself a PBM expert. I think that we all have the opportunity to grow every day in this space, and so I love that aspect as well. So it pushes me to grow, and it pushes me to be innovative, stay ahead, and think about what we can do to improve people's lives at the individual level, because I really think that's what it's about. It's a much bigger task to address healthcare issues when you're thinking about it down to the personal level.
No doubt about it. And Corey, you're becoming quite the speaker and panelist. I've seen you on a lot of panels on social media in this day and age, in the pandemic of the E presentation, if you will. And I really appreciate your passion for just looking out for the individual. And as you shared, that really kind of was birthed out of you becoming a mom and looking for maybe a different career path. I actually have a PhD in educational leadership. So you and I share an educational background, and here we are both in the business world. But what I think, and I'm also going to add folks, the Benecard PBF website link to our website at the not-for-profit at spendlessonhealthcare.org. So if you want to know more, go to spendlessonhealthcare.org. If you go to the partners portal, you'll see a discount pharmacy suggestions. And you may be aware our 10 free tips to spend less on healthcare that we offer there. One of them is shop for pharmaceuticals. There's so many options out there. I definitely would vouch for Benecard, saying they're one of the best if you have an employer that is willing to work with them. There are some others for direct to consumer. But Corey, that's the question I wanted to ask you. Knowing what you know now, and you know not just how great your solution is, but some of the competitors and what they do. If you are, let's say if you're unemployed right now, because a lot of folks that are unemployed because of the pandemic, or if you work with an employer that is not engaged in a pharmaceutical program, what tips would you offer for a single mom, a married couple, a family that's just looking to save a few bucks? Because you can save more than a few bucks if you do this well.
Yeah, absolutely. So I would say that understanding your benefit is the number one key. So getting involved in the HR process during enrollment, asking questions, understanding how they evaluate that process, because we know that year after year, study after study, there is 30% of dangerous and inappropriate pharmaceutical care. And we are seeing 30% savings across the board. So it tells me there's a story to be told there. And so I think it's really important to, speaking of education, to understand. So however it is that you can understand the decision-making process behind the scenes with your company, of how they're choosing their pharmacy benefit manager, and are they making that decision based on health concerns, cost, or is it simply ease? Because oftentimes, like I said, it's so dynamic, it's easy just to go with the checkbox of, maybe what your carrier is suggesting. So just starting to understand and educate and ask the right questions, which also translates into pushing the HR group to better learn themselves.
Yeah, and this is set of those 10 free tips that I mentioned. Two of them, Corey's really hitting them on the head of the nail here, which is one, you shop for pharmaceuticals. You just ask if there's a generic, if there's an alternative, and another one. And it's funny because people are like, wow, 10 free tips, these are going to be amazing. And no, I just told you two of them, and they're basic common knowledge that we do in every other aspect of our life. Why don't we shop for pharmaceuticals or different hospitals or surgery centers? And why don't we ask our doctor, the person we trust the most? How many times has somebody got to the pharmacy and said, oh my gosh, this medication is $120. I should have asked if there was a generic. And what one of the challenges you face, even if you do implement those two of those 10 free tips, guys, is almost every doctor, as a former hospital CEO of 10 years, I can tell almost every doctor is being compensated by pharmaceutical companies for one reason or another. So oftentimes, even asking them if there's a generic, they're going to give you the hee-haw, well, I'm not sure, it's not as good. But if that's the case, you can go to your benefit manager, call somebody else, call Corey, call me, ask. There's plenty of websites you can go to. So just shopping and asking are such important tools. So Corey, do you have a story, like a success story of one of your clients, whether a company or an individual, that you can share about what a difference using the resource that your organization provides made to them, both financially and as a patient? Because I keep hearing you say how important it is to focus on the individual, and you guys are so focused on the patient's health, but also in the process, they're saving thousands.
Yeah, absolutely. Gosh, if I could handpick one story. So I would say that when I came into this space, I was just floored to learn that the clinical efficacy was not taken into consideration in, generally speaking, in business practice. And I'm thinking we're just filling prescriptions. We're not considering the health impact of the patient. What's happening here? And that is the core value of Benecard. It's all about the patient, what's right for the patient. And that's what every decision we make is on. So we have pharmacists on every account, and these pharmacists are looking at every claim and identifying opportunity to help a patient. So if we have a patient on a specialty medication, they are getting their hand is held. They're getting outreach every month to make sure they're not having side effects, to make sure that they're receiving medication, administering it properly, and it has an overall just impact on the health and well-being of the groups, which translates into the medical spend and the medical needs as well. And we have a program that's called Pharmacogenetics.
Sure.
And what this does is, it's so interesting. It's kind of like the ancestry.com, or it's the DNA test of how you metabolize medications. And it's a simple test. It's a saliva test. And then you have essentially a stoplight, and green is these medications you metabolize and can handle. Yellow is you may or may not have effects from this. And red is you very well have adverse effects. And a lot of times with ADHD in children, we've seen results from this test where we're getting kids on the right medication right away. We're not playing that trial and error game. We're not in situations of adverse effects, or quite honestly, just the complete opposite effect of what you would hope to achieve, which can be detrimental in a classroom or at home. And so that alone has had a significant impact on trial and error, cost,
Wow.
frustration, and overall health of the kids that we've seen this, and adults as well. But it hits home for me when we talk about the success stories around kids.
And I'm so glad you brought up pharmacogenetics, and I want to wrap up in the last couple of minutes on pharmacogenetics, but I also want to remind those folks that are listening or watching, the average family in America spends $23,000 a year on their health insurance each year before they see a single doctor or pay for a single pharmaceutical. That's what you're paying. My paycheck, my company, I don't even take benefits from them because I joined a cost sharing plan, but they wanted to take $700 out of each of my paychecks. That's almost $1,500 a year. Times that by 12, add the $5,000 deductible. There we are at $23,000. Okay, so a good chunk of what those dollars are going to are pharmaceuticals. Plus, remember, you as the consumer are paying on top of that, so it's even more expensive. So these solutions are so important. We have a lot of those solutions on our website, spendlessonhealthcare.org, but you also can get those 10 free tips in an immediate download right now. Even if you're in a car, have somebody else text it, but text the word Josh. You can see how it's spelled right here over my shoulder, to 72,000. Text Josh to 72,000. We'll send you those 10 free tips. I'll also connect you with Corey's Benecard PBF website when you do that. Corey, before I wrap up on pharmacogenetics, you're based out of the Tampa St. Pete area. Is your company national though?
We are national. We have members in every state.
Okay, awesome. So I'm going to do a little shameless self-promotion here because Corey brought it up and it's such an amazing topic. Health Wealth for You, the book that you may or may not have read, folks, is available online for 99 cents on Kindle. Chapter 3 of Health Wealth for You is called Health Wealth Step Number 3, Full Genome Sequencing and DNA Testing. What you're going to get out of that chapter, and again, you can buy it right now for 99 cents. You can imagine how rich I get off of that. But you can buy it and read about pharmacogenetics. And I cannot, look, Corey works for the company. I don't. I own a not-for-profit that's to help you live healthier and save money. Pharmacogenetics is not witchcraft. I'm getting so excited. I'm hitting the mic now. It is not like futurist. It is here. It is now. It is real. It exists. It is a roadmap of your personal body. And it says, hey, Advil might not work, but Tylenol will, or this medication will not work, but this one will. And here's the dosage you need. Here's how many milligrams. And here's what else I'm going to share with you about that. And I learned this, and Corey, you may not even have gotten this deep into it yet because I was on the operations side running a hospital. I took this to nursing homes and hospitals in 2013. Here is the results of the DNA test of 15 of our senior patients in front of 4 doctors, and the look on their face, they were terrified. And the reason they were terrified is because they all pulled me aside silently and said, this is amazing, it's awesome, it's a personal roadmap. But they also said the system, the hospital system, the computer systems aren't ready for this. So I wished I wouldn't have seen it, because if I keep giving this patient the medication I'm giving them, which doesn't work as well, and they die, and their pharmacogenetic makeup says they should be taking this, I'm at risk. Guys, that was 5 years ago and a lot's changed, but that really helped me understand, wow, this is real. This is real technology. And like Corey, as many of you know, I'm a public speaker when there's not a pandemic. I speak, you know, up to 25 to 50 times a year, and I talk about pharmacogenetics. And when I speak about it, I can tell you that there's every few times I present, there's somebody that comes up to me with tears in their eyes afterwards and says, what you said changed my life, or what you talked about changed my life. And that's happened several times on the topic of pharmacogenetics with people who said, even when 23andMe was new 8, 9, 10 years ago, I took it to my doctor. So here's what I want to tell you if this is of interest to you. You can get your pharmacogenetic test. It's a DNA test. It's also called full genome sequencing. Get the book if you want to learn more about it. Through almost any of those, Helix, Color, Ancestry, reach out to Corey. She'll connect you with some other. But when you get it, I want you to take a picture of that or take it with you to the doctor every time, because the doctors are hesitant to engage on the pharmacogenetic on your personal roadmap until you hold them accountable. And guess what? It's capitalism. If you don't ask them, say, hey, doc, if you don't pay attention to this, I'll go to a doctor that will. So Corey, talk a little bit more about what pharmacogenetics has meant to you, and not just your company, but to your family since you've learned about it over the last few years.
Absolutely. So you talk about the equipment, and then and this is this tool, and then what do we do with it? And that is such a key component. So for us, it's all about how can we help facilitate? So we're taking this information and we're plugging it into our system, and we're able to identify right away, no red X on that one. We are not filling that because that is not good for this patient. So we're helping to facilitate that, the delivery of the result. So that's where that really translates. It's one thing to know, it's one thing to have the information, but it's only as good as the piece of paper unless you do something with it. And I'll be honest, we are welcomed by the doctors when we call and have this conversation, and they, you know, because that everybody has their own subject matter expert role, and they understand that, you know, that was a component that they just didn't have, a missing piece of information, and they're grateful for us for our partnership and identifying what's best for the patient. And like you said, if they don't, then it might not be a great fit. So I think it's you know, just having family members with stage 4 cancer and understand,
yeah, so effective in the cancer space for sure.
What that information could have provided at that time. If you knew about it and you could have, you know, we have to equip ourselves and empower ourselves.
Yeah. So folks, we're going to wrap up with that. But hey, personalized medicine, folks, my books talk all about it. Pharmacogenetics is one of the most evolved components of actual personalized medicine. And if you don't really know what personalized medicine means, it means like find out everything you can about your body and how it differs from your neighbors, from mine, from Corey's, and let the doctor treat your body and your DNA makeup. And pharmacogenetics is one of the most advanced. Nutrigenomics, what you eat, is not that far behind, but it is behind. Pharmaco's way ahead. You can read about that in the book. So Corey, I'm going to wrap up with a very serious question I didn't warn you about, that we always wrap up with. And I'm going to take 3 guesses to this, which I've never done. I always ask people, so don't say the answer yet, what your favorite sports team to root for is, whether college or pro. So I'm going to guess either the Tampa Bay Buccaneers, the New York Yankees, or I'm going to go with the Hurricanes. So who is it? What's your favorite team, whether it's baseball, basketball, football, soccer?
It's actually the USF Bulls.
I saw that you went to USF, but I was gonna.
Yeah, we have tickets, you know, so we are those lonely folks in the stand that are there to support, because
University of South Florida. There you go. So now we know. So, hey, Corey, this has been fun. I'm so glad you took up the topic of pharmacogenetics. I'm glad that you made that career change to be in this industry. Corey, folks, you can find Corey Biscoglia on LinkedIn. You can also find Benecard PBF online, or you can find them at on my website at spendlessonhealthcare.org. Thanks so much for joining us, Corey.
Thank you.